Hi, I'm Matt Schwartz, Chair of the Worksite Wellness Council of Louisville. I'm here with Dr. Jennifer Redman-Knight, and she's with the UK College of
Public Health,
thank you, and with the Kentucky Cancer Consortium. So we just had a great program talking about cancer prevention and some of the issues that we have in Kentucky, because we're number one in an area that we don't want to be number one. So tell me just a little bit about that. I mean, I know we're number one in the spot we don't want to be.
Absolutely. So really, we have a lot of different cancers that are going on. Lung cancer is the reason we're number one. So if you think of the top cancers, something we really need to do something about is lung. We can also really do something about colon, breast, and cervical cancers too. So working together, there's a lot that can be done in that.
Okay, and we had some discussion about some of the things that employers are doing right now, and so we would capture a couple of those ideas. What are employers doing right now that they can help participate, get people active?
Absolutely. Well, one of the things that employers can do is really to provide support for folks to utilize their health plan benefits. So as a result of the Affordable Care Act, a lot of cancer prevention and early detection things are no cost. So there's incentives and encouragement through wellness programs and things like that for the folks to get their screenings. Another idea is folks are bringing people on site so that some of those wellness conversations can happen at the work site. So those are two of the things we discussed.
Right. I know the ACA has 63 preventive services that are automatically covered, and we talked a little bit about like colonoscopy, one that some people don't do, and then they were getting caught. They go for a preventive screening, but then they were getting caught on it being diagnostic, and they'd get a big bill, but that's now been legislated out.
Yes, as of this spring, there was legislation passed that as of actually January, it goes into effect of 2016, the whole screening process had to be covered, which includes colonoscopy with polyp removal and even pathology in that still needs to be no cost.
So yeah, so most people today now, I mean, you really can go in and get a free annual screening free.
Yes,
so
exactly.
Well, that's good. So then we talked about some of the resources that you guys, like what you guys are doing here in Kentucky, and you talked about you've got a group of 70 organizations together. Tell me a little bit about that.
Absolutely. Well, the Kentucky Cancer Consortium brings together 70 organizations saying, all right, what can we do about cancer really in a statewide or multi-regional way? A lot of what we focus on are policy or systems changes. And, those include the Affordable Care Act. They also include smoke-free, comprehensive smoke-free. That includes helping people address radon issues. There's a lot of different things that we are able to focus on collectively, increasing colon cancer screening. And so really saying, all right, how do we help people make it easier, if you will, to find those prevention and early detection pieces?
Great. So I'm an employer. I want to go find out what I can do. So I know you talked about several handouts, things that you all have created.
Yes.
5-pager, 2-pager, 1-pager. So where do I go? What's the website address?
You go to www.kycancerc.org, KYCancerC, or you could Google search the Kentucky Cancer Consortium and look for our Affordable Care Act and Cancer team and get all kinds of resources, both handouts as well as web links that are organized in one place. Again, the Kentucky Cancer Consortium, Affordable Care Act, and Cancer Team.
And I know you'd also offered, that you really want to be a resource. And so again, if people want to find, hey, I want to get YouTube videos for this or that, or I want to come up with some creative way, you want to hear from
Absolutely.
folks, because that's the type of thing that you all love to do.
Absolutely. We want to make a difference and make the healthy choice the easier choice and help groups, work sites, employers, and health systems be able to have systems and resources that they can utilize and connect them to that. We're great connectors.
Great. Well, Dr. Knight, thank you. This was a great session. Again, if you missed it, we're here the third Thursday of every month at Baptist East Milestone, and we'll look forward to seeing you at a future session. Thank you.
Thank you.